The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks.
Hey everyone, this is Jonathan Marks. Welcome back to Go to Health. Today we have another great show, and we're going to be talking about new concepts in healthcare and how to make it better. Here's a big problem in our medical system today. Much of medical care and coverage in the U.S. is fragmented. You have experienced this, I'm sure. You visit a number of doctors in different clinics or systems, especially for complex or chronic conditions, and continuity and coordination across clinicians and settings is often lacking. In addition, the electronic medical records held in one healthcare setting are often not shareable with other offices, further contributing to fragmentation. So you're seeing a number of doctors, but no one has all your information. The absence of a true healthcare system has been detrimental to patient-centeredness and continues to present obstacles to making care more patient-centered. With us to talk about this today, patient-centered care and value-based care, is Jason Spangler, MD, MPH, and CEO of the Center for Innovation and Value Research, which is an independent nonprofit research organization advancing the science, practice, and meaningful use of patient-centered care to help make healthcare more meaningful and equitable. They do this by focusing on patient-centered outcomes, to promote equity in all aspects of healthcare, with the goal that all patients have the ability to achieve their optimal level of health. Dr. Spangler has worked in the professional health policy and public health sectors with pharmaceutical and nonprofit organizations for 20 years. He has degrees from Penn State University College of Medicine, the University of Pittsburgh Medical Center, and Johns Hopkins University. He's also worked internationally in Costa Rica and Kosovo. Welcome to the show, Jason. How are you today?
I'm great. Thank you, Jonathan, and thanks for having me.
Sure, my pleasure. If you don't mind, let's define three terms first so people understand what it is you do. I want our audience to learn more about what's happening in medicine today. What is patient-centered medicine? This is a term I keep hearing, but explain to us what that is.
Patient-centered medicine is actually focusing on the patient and what the patient's preferences are, what the patient's needs are, and the outcomes that are important to the patient, even if they might be different than what we want as the best kind of clinical or health outcomes. Mm-hmm. So it's really asking the patient, what they're looking for in their care and focusing on that and not the other aspects of care.
Isn't that what healthcare always should have been? I mean, what was it before if it wasn't patient-centered? I don't get it.
Yeah, no, it's a great point. And that's the way healthcare and medicine specifically should have been. And I think for most of the history has been. I think the focus, in the past, however you want to define it, 50, 100 years, there's been more focused on the research around, how to improve care. There's been more focused on how do we, make health better, not considering things outside of health or that are impacted by health that are important to patients, families, and caregivers. And so, I think we've drifted away from that because of the system that we have. You mentioned in the intro, the fragmented system, and also all the other stakeholders, whether it's providers or the payer, the insurer itself. There's just so many stakeholders now that are involved, and what they prefer or what they want, I think, has superseded what the patient has wanted.
Got it. Good. Thank you for explaining that. Second term, what is value-based healthcare?
It's another thing that we need to define better and do a better job of. Most of medicine over the past, I would say 40 or 50 years has been focused more on the amount of care you get and not how good the care you have. And mainly because of the incentives in the system, providers, clinicians, they got paid based on, the amount of work they did, whether it was the amount of visits or the types of procedures they did. And so that the incentive was to do more, even if more wasn't always better. And value-based care is getting back to, let's do what has the most value to the patient. And so that might mean less care if we think that, not just to save money, but because we think that's more helpful for, a patient.
Right.
And so it's really looking at, at its heart, value is just outcomes over cost. And so it's trying to provide the best outcomes, but also considering what the outcomes the patient wants, over, the cost. And the cost is not only just financial cost. There are other costs that are important to patients and families and caregivers, but including all of those in kind of the value equation to provide, the best, most efficient care.
Great. Thank you. And the third term, and then we'll talk more about what it is you actually do. But what is
Sure.
health equity? We keep hearing a lot about equity. What is health equity?
So, there's a lot of definitions around what equity is. We usually use the definition that's similar to what some of the federal health agencies use around equity, but it's basically making sure that everybody in the system, which is everybody, right, receives the same level of care at the same time, in the same timely manner across the entire system. So the amount of care or the type of care, the quality of care doesn't change or differ depending on your status, whether it's racial status, ethnic status, socioeconomic status. So regardless of where you are in the system, you're receiving the same quality of care.
Got it. Thank you. I really appreciate the definition or the explanation of those three terms. So now that we've gone through that, how does the Center for Innovation and Value Research address these issues? What's your mission?
So our mission, and you mentioned this a little bit earlier, is to advance the science, practice, and use of patient-centered health technology assessment to support those decisions, as you mentioned, to make healthcare more meaningful and equitable. So let me just flesh that out a little bit. So we are a research organization, as you mentioned, and our research, that's the science part of it, is to make sure that the way value is determined in new medicines, new innovations within the healthcare system is done from a patient-centered perspective. Historically, it's been done from whoever pays for those services, whether it's medicine, procedures, et cetera, which makes sense, right? They want to know that, going back to value, that they're getting value out of that, and they're the ones paying for it. But what has not happened is looking at it from the patient's perspective and what the patient values. And so we're trying to take that lens to make sure that, when you're looking at new innovations or technologies within healthcare, we look at the patient's perspective on what they value and then try to measure that. How valuable are these new things from the patient, family, caregiver perspective, so that when decisions are making about care that we talked about, hopefully it's value-based care, when those decisions are made, it's more meaningful for the patient and more equitable across the entire system.
Got it. Can you give us some examples of what you're talking about so we have more of a down-to-earth understanding of what kind of research you're doing?
Yeah, that's a great question. Thank you for the opportunity to talk about that. So I'll pick one project out specifically that I think kind of encompasses a lot of the work that we do. We have a project around rare diseases. We're currently in phase 2. We started phase 1 about a year and a half ago. But we are looking at the differences between rare and non-rare from a patient perspective. And when we try to measure the value of innovation that's trying to impact or improve or treat rare diseases, how does that differ from non-rare diseases? What do patients and families and caregivers value if they have a rare disease versus if they didn't? And so we had a project that, like I said, started a year and a half ago. We start all of our work with going to the patients first, so creating an advisory board with patient representation as well as others, getting their thoughts and opinions. And what we tried to do is actually really look at what do patients prefer when they're looking to treat their rare diseases? What kind of outcomes do they want? Is it just to get better, with the disease, which everybody wants. They want a cure for their disease. But if they can't get that, what are the other things they value, right? If it's a rare disease that affects, their ability to walk, obviously transportation would be an important part. And if they have a therapy that actually minimizes the impact of transportation, that would be really important to them. So that is a larger project that we're doing. We are now in the second phase, as I mentioned, and what we're trying to do now is not only categorize those preferences, but also think about, how can we address those? And I want to bring in another term you mentioned and we defined, which was health equity. There's obviously some rare diseases, something like sickle cell disease, where it affects a certain population different than others. And so we want to make sure that we're looking at the questions of equity around some of these rare diseases as well, because those patients might have different preferences than other populations with other rare diseases. So hopefully that gives you a little bit of a flavor of what we're doing. There is a research, a more technical side. This is all obviously research, patient-centered research, which a term you also mentioned. But there's also a technical side of this. We had talked about, and I don't want to get into a lot of health economics, but can we model this out? What does that look like in different rare disease populations, different categories of rare disease? So it kind of incorporates everything that we're talking about our mission, the technical science part of it, also the engaging patients early on, bringing equity into it, but really wanting to look at this from the lens of the patient so that regardless of what innovation comes, when we're looking at its value, it's doing it from that patient-centered approach.
So I'm just thinking of some examples. If I had a rare disease, I would think some of the issues are, how do I find a doctor who's going to help me about it, has any information about this rare disease? How far do I have to travel to get treated? I'm also imagining if there are pharmaceutical drugs that I need, who's manufacturing them and how much do they cost? Am I kind of hitting the target with what some of these issues might be with a rare disease?
Yeah, definitely. You're hitting some of those key components. Let me just add some of those. So not only like if there's a therapy, not only who's developing it, but how is it administered? Is it, a series of pills, or do I need an injection? And going back to transportation, can I go to my pharmacy and get it, or do I need to go to kind of a specialty hospital or a center of excellence? And is it something I can get one injection, or do I need an infusion that takes several days and I need to be watched in the hospital for potential side effects? All of those things kind of factor in. And even, going beyond, we mentioned transportation, but how does this impact my productivity? I'm a person with rare disease, but I have a job. Does it make me more productive, or is the therapy just kind of wipe me out for an entire week and then I have no productivity? And so all of those issues we're trying to look at. As you can imagine, it's complicated, and we need better data for a lot of this. And so we're also obviously big proponents of those things so that we can do a better job of measuring.
Now, when we talk about measuring and we talked about value-based care, how do you measure the impact of your research? I mean, you can do the research and then it can just sit there on the shelf. Do you have a way of knowing if your research is getting implemented or improving care?
Yeah, I'll talk about it from a larger perspective and then a more specific perspective. So from a larger perspective, all the work we're doing is part of our strategic plan. It's top of mind because we're right now developing our next strategic plan for the next few years. But we have metrics around that, and so all of and the research components of that strategic plan will have larger metrics. So from a larger strategy perspective, we're measuring that. From kind of diving a little deeper, a little bit more detail from a tactical perspective, we try to incorporate that in the beginning of the project. What are the impacts we want to make? How are we communicating that or disseminating all the work, the research and other related work that we're doing, and how can we measure that? One of the things I mentioned earlier that's also a part of our process is that we bring patients in early on. We're really big on patient engagement and getting the patient involved, so we bring them on early on, and so we get a lot of feedback as well from our patient partners and the work that they do, and are they disseminating among their organizations and their networks, and is it having an impact? I think probably the hardest area is with the actual decision makers, whether that's from a policy perspective, folks in the government that's making policy, or from a payer perspective, the insurance that's actually covering these and making changes in the healthcare of the patients that we're talking about, and trying to have them be aware. And that's what we're always working on. And it can be a struggle, but we have some partners with those folks, but we're always trying to make sure that we share that information with the decision makers, and then we try to monitor if changes are being made. And again, a lot of the way we hear about that is from our patient partners, that whether changes are being made or not being made. But it's something that we're continually working on, and making sure that we have metrics around not just the processes that we're doing, but also the outcomes that we want to make sure are happening.
When you talk about these decision makers, government, you mentioned, insurance companies, what incentives do they have for patient-centered care?
Well, hopefully they want their patients to be as healthy as possible, particularly the insurers, right? That saves them money if they're healthier than if they're sick. Obviously, that costs when they have to treat all of their patients. So, and I think there's also I wouldn't call it altruistic, but they want healthier populations. They know that that's better for society. It's better for them, even as a business, whether they're a for-profit or a not-for-profit. And I also think that, they are concerned overall for kind of population health, the health of all of their beneficiaries, to try to improve health. I think that's what incentivizes them, in addition to the financial incentives related to that. So I think that's, the incentive to just do that. There are, and maybe you're hinting at this a little bit, I think there are certain payers or insurers or models, integrated health systems that are a little better at this than others and want to focus more on this. I think we're trending more towards value-based care. I think we're also trending more towards a more population health approach, not just around health, but just the things around that influence health. We're starting to see this with some of the insurers looking at issues like transportation or housing, and understanding that if we pay for some of those things, even though it's not direct medical care, we know that that's going to improve the health of our beneficiaries and the populations that we're taking care of, and that will help us as a payer or as an insurer. And so I think we're trending in that direction, and hopefully we'll see more of that.
So as a member of the public, when I visit your website, which is at valueresearch.org, what will I learn? Can I participate in some of your studies? Can I make a donation? Tell us a little bit about what the interaction is with the public.
Yeah, that's a great question, and I love that you're willing to donate potentially. Yeah, we're always looking to partner with folks. So you're going to learn about all of the research we do, whether it's the more technical health economic research, whether it's the larger kind of research initiatives we have, like around rare disease and health equity and economic impacts. So you're going to learn about that. You're going to learn about all of the communication that we do as well, our presence, whether it's the healthcare sector, the policy sector. You'll learn about some of the policies that we have internally, as well as that we try to convey to policymakers. And you're definitely going to find opportunities to partner with us. Like I've mentioned already, all of the work we do, we engage patients very early on, at the very beginning, because we think that's the only real way to do true patient engagement and include that key stakeholder and bring the thoughts of that community, whether it's to a specific disease or just in general, into the work that we do. So you'll see that. You'll also see kind of events that we hold or have held in the past, and learn about those and see how you can participate in the future. We just had our annual meeting last week. You'll soon see more information about that and what came out of that. The last thing I'll say is that we also have resources for folks about our work, whether that's definitions like we talked about in the future, that of terms that people might not be familiar with, and then all of the work that we put out. We publish a lot, some in peer-reviewed journals, others just on our website, but there are plenty of resources around the work that we're doing that can help you as a patient, or you as a family of a patient, or you as a caregiver around the work that we do. And again, I'll finish with this. We'd love to have people interact with us, reach out to us, see how they can get more involved in our work.
Great. That's wonderful, Jason. So let me pull back big picture here. What are some of the most pressing healthcare challenges that you're currently addressing at the center?
So I would say from a big perspective or a general overarching perspective is making sure that the determination of value, which is what our research is focused on, is done from a more patient perspective.
Hmm.
Historically, value has only really been looked at from a cost effectiveness. Am I getting what I want with the cost I'm paying? We know that there are many other aspects of value that are important to patients. And so the biggest need is trying to incorporate those into how we determine value. And that's a lot of the science that we're working on and methodology, trying to design new methodologies to incorporate that in. And the reason why that's so important is decisions are being made around the value of healthcare in general and new technologies and innovations specifically that are just being done from that historical perspective, and
Hmm.
they're not incorporating these important aspects of value to patients. And so that's still pressing at a very high level. Also at a high level, we talked about earlier, moving towards value-based care. So I just talked about how do we do a better job of determining value from a patient's perspective, and then how do we translate that into the healthcare we're getting is actually based on that value determination and not just on doing as much as we can or as much as we have the ability to do just because of all the innovations and technology we have. And so I think those are the two biggest pressing needs. There are obviously policy issues that are important around whether it's drug price negotiation within Medicare or other aspects of healthcare at the federal level or at the state level. And we're working in some of those. But I think these overarching areas that we just talked about are much more important, that we need to do more so that the patient is, again, like we talked about, like it used to be, the patient's at the center of what we're doing and not just one of many stakeholders on the periphery.
Great. Thanks so much. This has been great information. I'm wondering, do insurance companies and some of your other stakeholders and decision makers, do they visit your website as well? I mean, we're trying to get these changes organizationally. So I guess, are the organizations engaged in the research that you're doing as well?
Yeah, so our key stakeholders, and I would put them into four main categories, are patient groups, patient advocacy groups, the patient community, researchers, life sciences companies who are developing these new innovations, technologies, and the payers.
Hmm.
All of them visit our site. I think some more than others. We partner more with the first three. And as I mentioned earlier, that the payer organizations and the payer community is one that we're trying to work with more and partner more and bring them more into the work that we do. But it's something that we're always working to do a better job. But I think we're starting to make some inroads in that area. And even some of our leadership, including our board, has representation from that stakeholder group. But that's how we're trying to continue to bring them into the work that we're doing so that decision making can be done better.
Great. Good. Thanks so much for all this information. We really appreciate you being with us today. We've been talking with Jason Spangler, MD, MPH, and CEO of the Center for Innovation and Value Research, which is an independent nonprofit research organization advancing the science, practice, and meaningful use of patient-centered care to help make healthcare more meaningful and equitable. You can learn more at valueresearch.org. Thanks again so much for being with us today, Jason. We really appreciated having you.
Thank you, Jonathan, for the opportunity. Have a great day.
Great. And remember, everybody, as we say at the end of every show, go to health. Take care. We'll see you again next time. Bye-bye.
Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.